Hi, guys. Welcome back to another Two Nobodies Talking podcast. Today, if you are watching us live on video, we're very happy to introduce our guest, Ian Manning. I'm one of the hosts, Nick. I'm joined here by Will and Eric, so it'll be a nice team effort here. Ian is from Orthocore Physical Therapy, and I'd like to kick it over to him so he can tell a little bit of our audience about his background.
Sure. Thanks first, guys, for having me. I appreciate it. Great to be on the show. So started out wanting to get into kind of PT in high school. I actually thought I wanted to get into AT, but I played volleyball, and much like most every physical therapy student and physical therapist probably got into it because they got injured. And so sprained my ankle and went down to see the AT. And so I just found it to be fascinating the way that they could feel around, ask questions. Now I know what was wrong, but know how to fix it. And so I was sitting there getting treatment, getting ready to tape, getting ready to get back in. And I was like, I think I kind of want to do athletic training. He's like, no, this life sucks. Go to physical therapy school. And that's kind of how I started my road.
Cool. Well,
yeah.
Ian, we know that you're known as the golf PT, especially in your area. And that's kind of how I found you on social media through Twitter. Was I came across you were the golf PT. So interesting to hear that you actually were a volleyball player first.
Yeah.
But I got to ask first, is Tiger Woods ever going to win a major again?
Absolutely not.
No.
Won't happen.
Okay.
He might win another tournament, but he won't win a major.
Okay. Second, what's your longest drive? I think everyone needs to know from a golf PT.
323.
I think you got all of us combined. Yeah.
I'm proud of that one.
It's hard enough for us to finish a 323-yard hole nonetheless. One try.
Well, I got to kind of practice what I preach. It doesn't look very good if I go out there and only hit a 220.
So just a quick question then. How long have you been playing golf, and when did you decide that golf was going to be a part of your career?
Yeah, so I started playing when I was 13. My grandfather got me into it, and it was always kind of on the back burner. I was a much better volleyball player, played in college, and but I would always kind of play on the weekend, play with my friends. And then after college, I kept playing volleyball a little too much and started getting injured. And so I kind of had to stop playing volleyball because I would show up to work on Monday and be worse off than my patients. I'd have back pain, I'd sprain my calf, I had rotator cuff, and I would literally be trying to take my patients through the test and show them how to do it, and I couldn't do it myself. So I was like, all right, I got to hang up the shoes and walk away from the sport that I really loved. But I had always loved golf as well. And so I started playing more golf. And then about 4 years into my practice, I literally did a Google search for golf PT. And the TPI program was the first thing that came up. So I kind of did a little research on that. My father-in-law is a graphic designer, and he does a lot of work with Titleist. So I asked him to talk to his people and ask if it was legit. And he said, yeah, great program. And that was back in 2008 when I went. And so it was just kind of starting to gain some traction. When I went, it was actually the creators of it, Greg Rose and Dave Phillips, who conducted my level 1, which they don't even come close to doing anymore because it's gotten so popular. So I was kind of at the forefront of it, which I'm proud of. And then just kind of started the path from there of getting certified for both medical and fitness. And I've been doing it ever since.
So a weathered road, it sounds like, that kind of brought you into the specialization. But I'm wondering, it's interesting. You said volleyball, you're getting a lot of injuries. You kind of had to walk away from that aspect. And I know that golf, for me, is extremely tough. I can certainly say I've watched Eric and Will play as well. None of us have proper mechanics 100% of the time. So I'm wondering, golfers are a big part of your business. They get injured. What typical movements or patterns of movements do you see most often cause the injuries in your golf patients?
So golf pain is number one, hands down. And usually the reason why you get pain in your back when you golf is whether it be a hip restriction or a thoracic spine restriction, something isn't rotating that needs to rotate, and then the back becomes a dumping ground. And so a lot of times you get golfers who, when they rotate into the backswing, stay on their left-hand side. Can be for a multitude of reasons. Could be strength, could be flexibility. And so it opens up the right side of the spine, and then when you for a right-handed golfer, reverse for lefty, but your trail side gets opened up, and then you go and rotate through and you close it down, so you get a lot of facet compression, which can lead to peripheral nerve issues depending upon how long they let it go. But so back pain is definitely number one, and it could be for a bunch of reasons, but it's really, really common. Then followed by that is probably shoulder. Shoulder pain is usually shoulder and elbow, but they kind of go hand in hand. Again, whether it be a shoulder range of motion restriction or a scapular stability restriction, it's not very different than what we see with any patient with a shoulder issue, an elbow issue, or a back issue. It's what was nice about going through the TPI thing is that it took me into kind of the SFMA world, which I had never seen before. So I learned more about kind of how you assess the whole body. So now that's basically how I conduct my practice. Every single patient who comes in, they get treated like a golfer, whether they know it or not. But you got to look at the whole body. You got to see where the restrictions lie, see where it needs to be corrected. Because otherwise, if you just go on the joint by joint approach, you end up missing a lot. And physical therapy is not hard. You can get rid of pain. I know it sounds stupid to say that, but you shut it down, take some pain relievers, massage it, the inflammation will go away. The real art in physical therapy is making sure it doesn't come back.
Well, Ian, especially with golf, it's a sport that takes so much practice, repetition. And you had said a lot about how someone who is practiced is doing a very similar motion, very much so. I mean, you don't swing both ways. You really do repeat the same golf swing, 1,000 million times maybe you play over your lifetime. So how much difference do you see between the casual golfer, someone that might just go out there? I mean, you're assessing the average body that wants to take on the sport versus someone who might have gone through this repetition a couple thousand times. Do you see a difference in their presentation or how you would prepare their body for the game?
I don't know if I necessarily see a difference in their presentation, but you definitely see a difference in how dedicated they are to changing it. You get some people who come in and they don't want to change their swing. They like their swing. They like the way they play golf. They don't want to ruin that handicap. And I mean, you've seen it with Tiger Woods. I mean, look at how horrible he was when he first got injured for 2 years, but then he kind of came back, and you take the best golfer in the world at the time, it takes him 2 years to get back to where he needs to be. I don't think people appreciate how much it takes to change a motor pattern. And a lot of times that's what it is. The flexibility or the strength deficit leads to that motor pattern. And when you correct the strength and the flexibility deficit, the brain still says swing this way. So it's a matter of then taking it into the motor pattern change, which is a long process. And it really takes dedication. And one of the best analogies I heard was from a golf pro, Derek Cooper, I used to work with. He said, changing a motor pattern is like making a new path. So you're walking in the woods and you're used to taking that same path. Well, now you got to walk over here and you got to trample that grass down. Every time you swing the same way, you're just taking that same path, and that path doesn't go away. You got to take that new path and trample that grass down. And then eventually the old path will grow in and you have your new motor pattern. So if you're just out there swinging and you're not giving yourself any correctives of what to do or any biofeedback or anything like that, you're just swinging the same way. You think you're making a change, and you're lucky enough to hit the ball a new way every now and then. So every single golfer that I take care of, whenever I try to send them back to the range, I want to send them back with some sort of corrective or some sort of feedback to make sure that they're changing their swing. So moving forward, they don't come back with the same issue.
And hey, I mean, I know a lot of what we're talking about is a very, very specific field of movement. And the hot topic in a lot of sports training, especially for athletes that play a sport for 5 or 6 months out of the year, is cross training, and the principle of preparing your body outside the season to try to counteract that repetitive motion or prepare yourself for injury prevention. Where do you see cross training falling into play in the golf realm?
Yeah, so I think, like you said, the golf swing is unidirectional when you're playing. The biggest thing that you need to do is honestly train the opposite direction, because you got to keep yourself balanced. And the nice thing about that is they call it the deceleration theory. The body won't speed up what it can't slow down. So it's like having a Ferrari with forward brakes. You're not going to drive that Ferrari 250 miles an hour if you know your brakes aren't going to stop you. The brain does the same thing. So you're not going to swing 120 miles an hour and not break down unless your body has the ability to slow that down. So a lot of what we do, and a lot of what I do with my golfers, is make sure that we're training the opposite swing just as much as they are their actual swing pattern. Dustin Johnson is actually a really good example. There's a good YouTube clip out there of him entering a drive competition with a TaylorMade staffer. hits it lefty farther than the staffer hits it righty. So, I mean, and he's by far, especially right now, probably the hottest golfer on tour. Yeah. And he does that. He trains to the right as much as he trains to the left.
Is that a recommendation you give a lot of your patients or clients?
Play lefty?
Play both. Play both ways.
Definitely not. But we do, like, if you're doing med ball slams, you have to do it to the right just as much as you do it to the left. If you're doing any type of core rotation, you have to do it to the right just as much as you do it to the left.
So what you've described is a lot of movement-based rehabilitation. But before you can even get to that point, like if I go golfing tomorrow, I'm going to hurt the next day. Mm-hmm. Pretty bad. I'm not going to want to do any strengthening, exercises, really a lot of movement at all. For that hot patient, for that person that's really acute, I know another specialty that you've really found a niche for is dry needling. And I'm wondering if it relates a lot to golf, or if this is something that you can really step back from and say, no, this is completely separate from anything else I do, and here's why I like it.
Yeah. So I actually got into dry needling because of golf. And I have a C5-6 facet right side that flares up every now and then. And I was at the World Golf Fitness Summit in 2010 and staying in a hotel, bad pillow, bad circumstances, travel, all that stuff. And it locked up on me. I literally had like 5 degrees of right rotation. And one of the guys who I met there was from New Zealand. And he was certified in dry needling. I had never heard of it before. And so we were at breakfast and he was sitting to my right. And he asked me a question. And I literally gave him like the, what? And like couldn't even turn my head. And so he's like, let me treat you. Let me see what's going on. So we went up to his room and did a dry needling session, did some manual release stuff. And literally in 15 minutes, I had zero pain and like 90% return of range of motion. And I said to him, I was like, I don't know what you just did to me, but tell me the name because I'm going to learn how to do it. And then Kineticor was there as well. And he had introduced me to Ado and I started going down that track. But it's unbelievable for golf. I have plenty of patients who are, you got the championship that's coming up this weekend. I did something, I bent down and I tweaked my back and now I can't swing a golf club. So it's great for that. The thing that I have to find myself holding back on is letting patients rely on it because it's that good that it'll take the pain away that they won't do their stuff to correct why they got the pain in the first place. It's almost like taking a pain reliever. Pain is your body's way of saying something is wrong. Not to give another car analogy, but it's your check engine light. And if you don't pay attention to your check engine light, doing the dry needling or doing a pain is like taking your thumb and covering up the check engine light. You can drive and you don't think there's a problem, but eventually the bigger problem is going to come out. So I use it to allow people to move better, but I don't rely on it.
To turn the check engine light off.
Yeah, exactly.
Well, there's a lot of really interesting, media and evidence coming out about dry needling, but certainly here in Pennsylvania, dry needling hasn't taken off and it doesn't have the following that it might have where you are. So for someone listening in that isn't as familiar with the dry needling technique, maybe you could explain it to a student that's coming up that would like to get a layman's terms, or maybe go through some of the criteria or screening you would do to find the appropriate patient for dry needling.
Sure. So dry needling uses acupuncture needles or fine filament needles, however you want to say it. And it's different from traditional acupuncture, where traditional acupuncture works off of meridians. So back in ancient China, they started to correlate sensitive skin areas with different diseases and different problems, and they started to map out those meridian lines. And the point, what they do with acupuncture is they try to align the chi of the body. And it's kind of like, think of a problem on the chi line as being like a dam in water flow. So they want to remove the dam to allow your chi to flow naturally through that meridian line, and it helps with your issues. Dry needling is very different, to where we're just going after sensitive trigger points. So we just want to alleviate the pressure of the trigger point, reset the muscle to its normal resting length to allow for better motion. It improves blood flow and helps to decrease pain. And so whenever I have a patient who comes in, again, if it's one of those super hot patients and I think it can help them to alleviate their pain, especially with the way healthcare is going and patients are getting less and less visits, it allows me to get to the source of the issue, get past the pain that much faster than trying to do traditional manual techniques, which might not be effective for a couple, 3 visits. There are certain red flags where, if you have a bleeding disorder, obviously you can't do it. Any types of cancer or immunosuppressants, you can't do it. Pregnancy, the kind of the big red flags that if somebody comes in, and even if they're a super good candidate, I just can't do it with them. So I certainly don't use it with everybody. Some patients are just afraid of needles and they don't want to do it. For the most part, I can try to kind of convince them, but then there are just those patients who don't want it. So, there's a mild screening that I do, but all in all, if I think you can benefit from it, I'm probably going to do it with you.
That's awesome. I think there's still a lot of people out there who just aren't aware of what it is or see, signs maybe if they're going to a clinic and are kind of confused about what it is. So I think that really helps to kind of help people out there who are listening who might not know about it a little bit more about dry needling. And so I was going to ask, from a clinical side, do you find then that you're typically using dry needling as some of the beginning sessions to calm down pain? Is it something that you continually use throughout a treatment plan, obviously depending on pain and inflammation? And then do you find it so effective for golf because of that overuse of specific muscles? And that way, in that way, using dry needling can help hit those triggered muscles that are becoming so spasmed?
Yeah, so I think it's obviously great for pain. It's also great for range of motion. Especially when it comes back to golf, everything is about thoracic rotation. The more you can create, the better your swing is going to be. There's a lot of times where clients will have a locked up T-spine. So you treat the T-spine and allow for greater range of motion. There's plenty of times where I'll use it early on and then get away from it and get into, as long as somebody can come in, we screen them and they can move, I don't need to do it. If you have no pain and you have good range of motion, and I don't want to stick a needle in you as much as you probably don't want me to, because it's an invasive treatment, and the truth of it is that the biggest risk is an infection. So, I don't want to test my liability insurance. I haven't tested it yet, and I'm planning on doing it. So, unless it's really appropriate and really necessary, I'll get away from it. It just depends on how many treatment sessions it takes. And some people, it's not 100% effective. Nothing is. So I'll give people, let's say 3 or 4 sessions. If you haven't shown any signs of improvement by the end of that, it's just not going to work for you. So I'm not just going to keep shoving needles in you and hoping for the best. Like there's definite criteria to where I'll stop using it.
Okay.
Wow. Well, it seems like a great adjunct to the theory that you've already talked a lot about. And when you have a skill like golf, where we've already talked about repetitive motions, we've talked about the need to both stabilize and mobilize, its acceleration and then control through that movement. And like any sport that you do over and over again, it has this high level of energy, there's going to be some acute flare-ups, and dry needling seems to go hand in hand. And you really have I think a good formula for explaining that, certainly to us, and I'm sure it's very well received by your patients as well. So I guess to follow it up, I'd like to ask maybe if you give us a few tidbits on if someone were to walk into us, other than refer them straight to you, of course, if they can make their way to Rhode Island, what are a few of your favorite golf exercises for somebody, say myself, that would really need to improve their consistency, or maybe improve dynamic stability for a drive?
So I think first and foremost, you have to make sure that you can get into a good postural position. The thing that I see the most, especially with the older population, and even unfortunately now with some of the kids, is you see that rounded forward T-spine. So first things first, you got to get that into a more neutral position, because it's not going to rotate unless it's neutral. So getting into your prone press ups or doing over the foam roller, I do a lot of dynamic neuromuscular stabilization with the diaphragm and breathing, making sure that the ribs are staying locked down. Because the thing that's tough about the T-spine is that it's mobile on each end. So you have to figure out a way to lock down one side to get a mobility into there so you can get it to be into a more neutral position. Then from there, you want to get it spinning. So I like open books. I like getting into a quadruped position, making sure their spine is a neutral position, doing some reach backs, a frame stretch where you're standing, one arm between your knee and your hand, rotating open, anything to get the more thoracic mobility, the better. The thing you have to be careful of is I'm sure you guys have seen it. You see people who do thoracic mobility and they really just end up doing shoulder mobility. So their T-spine stops and their arm continues. So you really got to coach people on that it's about rotating through the spine and through the chest and not about reaching as far as you can with your hand. And then for stability stuff, it's a simple model. The more narrow you can be, the harder you're going to have to stabilize. So getting people into quadruped with real narrow stance, or getting people into half kneeling, real narrow stance, making sure they can stabilize that, and then doing any chop lift, doing any horizontal rotation. All that stuff is golden as far as creating a lower body that's really stable with an upper body that can rotate.
Ian, you hit the nail right in the head. I think a lot of PT students you're given this information, but the application that you could provide for someone like a golfer is really, that's gold. You had worked in Boston for 8 years or so in a clinic. Did you pick up a lot of these things and just continue to develop it along that timeline and then say, okay, I can do this on my own? How did that Orthocore mentality come about?
So I honestly think back to when I first started working. I worked in an extremely busy clinic. And I think back to what I used to do with some of my patients, and I'm like, how did that even work? It was literally like flinging crap against the wall and hoping that it sticks sometimes because it was so busy. You just try this exercise. Hopefully it helps, And so once I started getting into the TPI stuff and learning about the SFMA and the things that you need to screen, I think that's when my career really started to take off because it really opened my eyes to what you don't learn in PT school. I think PT school is wonderful. I think we learn a lot, but especially if you want to specialize in orthopedics, you take 2 classes? That doesn't prepare you for anything. The PT school's job is to prepare you to take the boards and prepare you to pass the boards. Once you pass your boards, that's when you start learning. So you got to start taking those continuing ed courses. You got to find your niche and find out what works for you and really hammer it. So I was 4 years into practice, started the TPI stuff, started to do some of the stuff with my patients and started having some success, but it was still going crazy. And the other thing that happened, because I started having success, I would have aides and I would have PT students who would work with me, but patients come in, they're like, I don't want to see them. I don't come here to see them. I come here to see you. And no matter how hard you try to explain that we're a team, blah, 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 they're like, I don't want them to touch me. So now I'm trying to treat 5 patients in an hour, and it was just crazy. So that was kind of wearing on me. I was tired of treating 120 patients in a week. And then the golf stuff, I really couldn't do much with because you need more one-on-one hands-on stuff. And my boss was like, yeah, if you can do it in 15 minutes, do it. If you can't, then, you can't block out for an hour when the other PT is seeing 5. That's not fair. And then the final straw was the dry needling certification. I went and got certified, and my boss was like, you can't do it here, which I understand now being a business owner. He didn't want to take on the liability. He didn't want to take on the risk, but I was pissed because, I went out and learned. I know it's an effective technique. I saw how good it was. And then he took it away from me, and I was just downright angry. And that's when I was like, all right, I'm done. I'm going to do this on my own. And so it took a couple of years of saving up and making sure that I had everything in line. And then I went out on my own, and Orthocore was born.
And from what I understand about your company, you have a team. It's not just you.
Yep.
But you had mentioned you didn't feel comfortable handing patients over to techs or aides or students. You even if you felt comfortable with them getting treatment from someone else, you really liked having that one-on-one focus. Mm-hmm. I'm wondering if you could describe the team that you have there at Orthocore and how you feel that setup is ideal for the patients coming through your doors.
Yeah, so the other PT who I have working with me is she went to Northeastern as well. She was a couple years behind me, and she – we're both good at orthopedics, but she specializes in working with triathletes. And so she went and got her bike fit. So I think it's important when you get out, especially if you're going to open your own practice, to have a niche. Because if you go to the doctor and say, hey, it's me, I do PT too. And they're like, good for you. I got this other guy down the road who does the same thing that you do. You got to be different. And then, so she does that. And then we have a full-time trainer as well. And the whole goal of that is once people are done with PT, there are really bad trainers in the world, no offense, but I want to make sure when somebody walks out of my door, they don't go get hurt and then come back. So I have a full-time trainer who every single person when they graduate, they are offered a FMS screen with him to make sure they have an overall strength and flexibility basis to work off of, that even if they want to go and work out on their own, they're not going to get injured. So that's kind of how we progress them. And then we have the gym next door, the performance center. So if people want to continue to get stronger and more flexible, they do it in a safe way so they don't get injured again.
Ian, I have a question for you about Orthocore and the business that you have. We sort of have a special place in our heart of trying to learn more about both the insurance side of practice and sort of the up and coming cash practices. And we're curious, one, do you take insurance where you are practicing right now? And then 2, do you offer or are you considering offering some type of fee-for-service or cash programs, wellness programs, whatever you want to call it?
Yeah, so we definitely take insurance. I flirted with the idea of doing the cash-based thing, but in a place like Rhode Island, it's like one of the poorest states in the country. So you're just not going to, it's hard to build a practice off of that. Okay. We have the performance center built in. When you think about and you look at how insurance is going, unless you're a big-time hospital that can negotiate with Blue Cross or other big-time insurers, the reimbursement rates are going down. If I call Blue Cross and say, I'm not going to take your insurance unless you pay me more, they're going to laugh at me. Whereas if you're a big-time hospital, they're like, wait, we want your business, so yeah, we'll pay you more. So if you don't start to build in cash-based programs into your practice, it's going to die eventually, And so that's why we have the performance center, so that's all cash-based. With golfers, I have the work that I do with the K-Vest now, the biofeedback for the swing, that's all cash-based. I run some fitness classes. I do some one-on-one training with clients as well. It's all cash-based. So we still have some people who don't have insurance, and obviously, we offer cash-based options for them. But for the most part, we're taking insurance and then trying to progress it from there.
Okay. I have one last question, and it sort of deals with language. And one, how do you approach someone who comes in, some of the terminology you use to help address someone who, you want to provide a fee for service, say that it's not an insurance thing. And sometimes, we don't know your rates, but we know often that it's, more expensive than some people are expecting. How do you use your language to do that? And then 2, just kind of going through this interview, I've noticed you have wonderful analogies. And how important are analogies for you in your practice and patient interaction? It's something that I think I can speak for myself in clinical practice right now. We're all in rotations that analogies have a powerful impact on patients. And so that was a long question. I'll let you take the rest.
Yeah. So I think just insurance, people don't understand enough. So whenever we get somebody who wants to come in and use their insurance, quote unquote, people think that it's free. It's like, no, it's not free. Like, you have deductibles, you have copays, and people don't know what that is. So before every single person comes in, we contact their insurance company to see what their benefits are. And then we try to explain that to them. And it's hard because people still don't get it. But, we'll try to say, this is what we bill. This is what they pay us back. Here's what you owe until you reach X amount. Once you reach X amount, it's this percent. So we try to take time with the patients just because I want them to understand what they're going to owe, so that way I get paid. Because if you bill out an insurance company and it takes 30 days for them to send back what the patient owes, and then you send out to the patient a bill that they're not expecting, good luck chasing it. There are plenty of patients who just can't afford it, unfortunately, and you're going to end up eating it. So we try to take care of all that up front. And analogies are huge. I mean, you think about patient first language and, you're taught medial, lateral, blah, 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 blah. It goes over people's heads. So I try to keep it as simple as possible and using analogies to make people feel comfortable and it humanizes you. I mean, people come in, you're a doctor, right? And I'm just a master. I'm not a doctor like you guys are going to be, but people can get intimidated by that. And I'm just Ian, man. Like, I don't introduce myself as anything other than Ian, and I handshake, and I want to help you, and I'm on the same level as you. And so I think using analogies and using humanizing things makes people feel more comfortable, which is only going to make them that much better. I think humor is a big deal. I crack jokes all day long. I tell stupid stories. I don't think you can be funny enough in a setting where people are in pain. Seriously, because being able to laugh allows your pain levels to come down. There's research behind it. So if you try to be all staunch and above everybody, nose up, and dictatorish, you're going to have a horrible practice and people aren't going to like you. So just try to get on the same level as people and realize they're hurt, and you got in this to help people. So do whatever you can to make them feel better.
Pretty ironic that you got very serious there, Ian, about being comedic.
Humor can be serious.
Seriously, it's funny. I really like the fact that you developed yourself professionally. You took it on the road. You found a niche that you really wanted to pursue, and you did it. And how long has Orthocore been around now?
4 years.
4 years and running.
Congratulations.
Thank you.
Where do you see it being in another 5 years or another 10 years, if you will?
Yeah. So I'd like to be able to grow it to a couple, 3 practices, having like one main hub. So eventually I'd love to have a staff of physical therapists who are just passionate about something. Whenever I interview somebody, I want to know what you're passionate about, because I'll tell you to chase it. Because just like me with golf, I care about it, and I want people to get better to be able to do it. You know, if somebody took golf away from me, I'd be seriously depressed. So that's why I try to keep golfers in the game as much as I can. And that's why I have Christy, who specializes in triathletes. She just finished an Ironman 2 weeks ago, you know, so I'd love to bring on more staff and find their own niche within orthopedics. And then eventually I'd love to be able to just focus on golfers. So if you come into Orthocore and you're a golfer, you see me. If you have something else going on, you might see Christy. If you have something, you know, and down the line, try to find people to drop into those buckets so that you can talk to them and get on that same level of something that you're passionate about, because ultimately it's going to build the practice that much more.
That sounds great. You're building a team. That's great.
So, Ian, just to recap everything we've talked about today, you've been an incredible resource, I think, for especially the 3 of us. I think I speak for all of us. And also the students of physical therapy, students of health and wellness that are listening today. You know, you're very humble in your approach. You understand that you have a knowledge base and that you work very hard. You put in the time, you got the specialization, and you thought a lot about what you wanted to do to make the field better, you know, and then you did it. You didn't wait around. You went out and you got the specialization. And when the company you worked for said, sorry, we don't have a place for you, you carved it out yourself. And then when you realized that the best patient care came from building this team and carving out a safe area where patients can come to you and they can laugh in a realm where I never laugh when I'm golfing. So I really need to go you know, and you've created the best possible, from what it sounds like, place for someone to heal and then to improve and to continue on this path to wellness. So thank you so much for being on the show. If we ever get a chance to come up to Rhode Island, I'd love to play a game with you, but you have to play left-handed. That's the only rule.
All right, it's a deal. Guys,
thanks so much
for having me on. It's an honor. It's a pleasure. You know, I'm honored to be asked, and hopefully it helps whoever listens to this to just keep trucking, man. PT school is not easy. So congratulations to all of you for making it in, and congratulations to all of you for eventually graduating, and to anybody else who's listening.
Well, Ian, sorry, go ahead, Eric.
Ian, it's been incredible having you, and thank you again for the interview. But before we let you go, where can some of our listeners go to find out more about you, Orthocare, and all the rest of the work you've been doing?
Yeah,
so it's orthocorept.com is the website. My Twitter handle is manningolfpt, and then the Facebook page is just Orthocore Physical Therapy. So those are kind of the 3 main things where we have a blog on the website where we write articles, and then those always get posted to Twitter and Facebook. So as long as you follow one of those 3, you'll be caught up on all the latest and greatest from Orthocore Physical Therapy.
That's great. Hey, well, you heard it from Ian Manning first. All right, the Golf PT. For all of our listeners, thank you again for tuning in to Two No Buddies Talking Podcast. Today's episode can be heard at twonobuddies.com/podcast. Remember, that's Two No Buddies, TWOKNOWBODIES. So thank you all for listening. Two No Buddies, giving, sharing for all a more positive and healthier world. Thank you again, Ian.
Thanks, Ian.
No problem. Thanks, guys.